Good morning, everyone. The group number one consists of Kevin Aguilar, Isla Aguirre, Alison Caiza, Jocelyn Chavez, Dania Criollo, and myself. We will target the final oral exam today. Our presentation will be structured as a dialogue between a patient and a doctor, where we will explore two common medical conditions, allergy and conjunctivitis. For my part, I will be responsible for delivering the introduction to allergy. So, allergies. What are they? Allergies is an immune system reaction to substances that are typically harmless to most people. These substances, called allergens, can provoke a range of responses from mild irritation to severe and even life-threatening conditions like anaphylaxis. The immune system normally protects us from infection caused by bacteria, virus, and other threats. However, in people with allergies, the immune system mystically identifies allergens and harmful invaders and overreactions by producing antibiotics now in the immunoglobulin IgE. This triggers the release of histamine and other chemicals in the body, which are responsible for the symptoms of allergic reactions. Common causes of allergies. A wide variety of allergens can trigger allergic reactions including food. Common food allergens include nuts, eggs, milk, salt, saltfish, and wheat. Food allergies can range for the middle reactions, such as highest to severe reactions like anaphylaxis, which can be felt in not treating immediately. Seasonal allergies. Pollen is a well-known allergen in affected to people with high fever and allergic rhinitis. These allergies tend to be more prominent during certain times in the year, such as spring when pollen levels are high. Animal allergies. Pets' hair dander from animals like cats and dogs can also trigger allergic reaction. It's not the fur itself that causes allergies, but the proteins found in the animal's saliva and skin. Environment allergens. Mold, dust, mites, and certain materials like latex and another common triggers. For example, people allergic to mold may experience symptoms in that environment where will mold travels. Allergy symptoms. Symptoms can vary depending on the type of allergen and the route of exposure. Inhaled allergens, such as pollen or dust, often affect the respiratory system and eyes, causing eye irritation, red, swollen, and water eyes. Allergy rhinitis, safety of rainy cells, frequently sneeze and itch nose that throat. When allergens are ingested, such as the wild food allergies, symptoms may include gastrointestinal issues, nausea, vomiting, diarrhea, and abdominal pain, hives, red and edge wheals that appear on the skin, angioedema, swelling of the lips, tongue, and throat, which can make breathing difficult. In several cases, allergy reaction can escalate to anaphylaxis, a medical emergency that requires immediate attention. Anaphylaxis symptoms include extremely difficult breathing, widespread swelling and sharp drop in blood pressure, and loss of consciousness. Abilive treatment. Managing allergies involves two key strategies: avoiding allergens and relevant symptoms. Avoidance: the most straightforward approach is to avoid exposure to the allergen. For example, individuals with dew allergies must carefully read for labels and ensure the allergen is not present. Medication. Antihistaminic, these are the most common medications used to block the effects of histamine, which causes symptoms such as itching, sinusing, and the runny nose. So, thank you for the explanation. And now, let's delve into the real dialogue between a doctor and a patient.
Allergies. Doctor-patient dialogue. The doctor, Jocelyn Chavez, and patient, Diana Criollo.
Hi, welcome. What brings your heat today?
Hello, doctor. Well, the truth is that I've been a little uncomfortable. I've been having a lot of sneezing, nasal congestion, and sometimes my eyes itch. I think it may be an allergy, but I am not sure.
You are most likely right. Those symptoms are quite common with allergies. Allergies are an exaggerated immune system response to substances that are not normally harmful, known as allergens. Some of the most common include pollen, pet dander, mold, and even certain foods such as nut or shellfish. Have you noticed any relationship between your symptoms or exposition any of these?
Yes, it seems to get worse when I am around cats or when I spend time in the garden. I am also a little concerned about food because cats are after age. Shellfish felt very sick.
That sounds like a possible allergy to peat dander and pollen. When it comes to food, it's important to keep in mind that food allergies can cause more severe symptoms such as hives, gastrointestinal distress, or even difficult breathing. If you experience these symptoms after eating certain foods, it could be a sign of a food allergy.
Yeah, that one time I got hives and felt really sick to my stomach. I was pretty scared.
That definitely sounds like an allergic reaction. You should be careful as severe reaction can lead to a condition called anaphylaxis, which is a potentially life-threatening. It is crucial that you avoid those foods and, if necessary, I will prescribe an epinephrine auto-injector such as an EpiPen to have on hand in case of emergency.
And what can I do to prevent those reactions or at least alleviate the symptoms?
First of all, avoiding allergens is the best prevention. If you are allergic to pollen, for example, try not to go outdoors between 5 and 10 a.m. when pollen levels are highest. Keep windows closed and use air conditioning to filter the air. For pet allergies, avoid close contact with animals and clean your environment regularly to minimize danger.
That makes sense. What if I cannot avoid the allergy?
In such case, medication may help. Uh, Antihistamines and careful in relieving sneezing, itching, and nasal congestion. If congestion is severe, decongestants may be an option. Although you should not use them for more than a few days at a time. For inflammation, nasal corticosteroids can be effective, and if allergies are very severe, allergy shots may help you develop a better tolerance to allergens.
Those shots, how do they work?
Allergy shots, also known as immunotherapy, work by exposing your immune system to small amounts of the allergens. Over time, this trains your body to become less sensitive to that substance. It is a gradual process and can take several months or years, but can be very effective in some cases.
Interesting. And how can I be prepared in case of an emergency?
For emergencies such as severe allergic reaction, a syringe and epinephrine auto-injector is vital. In addition, a medical alert bracelet can inform others of your condition if you are unable to communicate. It is also important to read labels on the foods and products you consume to avoid hidden allergens.
I will definitely take those precautions. Thanks you for the information, doctor.
You are welcome. It is important that you take this seriously and follow this recommendation. If you need anything else, don't hesitate to contact me.
I will. Thanks you for your time.
Hi, my name is Alison Kaiser, and now I'm going to give you an introduction about conjunctivitis. Conjunctivitis, commonly referred to as pink eye, is an inflammation of the conjunctiva, the transparent membrane that lines the eyelids and covers the white part of the eyeball. This condition can arise from various causes, including bacterial or viral infection, allergic reactions to substances like pollen or animal dander, or exposure to chemical irritants such as smoke, chlorine, or contact lens solutions. Each of these triggers leads to the characteristic symptoms associated with conjunctivitis, making it one of the most common eye infections. The symptoms of conjunctivitis can persist from a few hours to several weeks, depending on the cause and severity of the inflammation. Common signs include redness, itching, tearing, a burning sensation, and a pus-like discharge that can cause crusting of the eyelids, particularly after sleep. The inflammation of the small blood vessels in the conjunctiva makes the whites of the eyes appear pink or red, a hallmark of the condition. Additionally, patients often experience the sensation of their eyelids being stuck shut upon waking, along with blurred vision due to the discharge. Given that conjunctivitis is highly contagious, especially in these bacterial and viral forms, early diagnosis and proper treatment are crucial. Bacterial conjunctivitis typically responds well to antibiotic eye drops, while viral conjunctivitis usually resolves on its own. Allergic conjunctivitis, on the other hand, can be managed with antihistamine or anti-inflammatory eye drops. General care tips include frequent hand washing, avoiding eye rubbing, using cold compresses to alleviate discomfort, and discarding any potentially contaminated items like eye makeup or contact lenses. Preventing the spread of conjunctivitis involves careful hygiene practices, as infection can be easily transmitted through contact with the contaminated surfaces, such as keyboards, doorknobs, or gym equipment. Avoiding contact with infected individuals and thoroughly washing any items that may have been exposed to the infection are also important preventative measures. By adhering to these guidelines, individuals can reduce the risk of contracting or spreading conjunctivitis and ensure a quicker recovery.
Hello, we are Kevin Aguilar.
And Israel Aguirre.
We are going to present a dialogue about conjunctivitis between a doctor and his patient. Good morning, doctor.
Good morning. How can I help you today?
I've been having these really uncomfortable issues with my age. They're red, itchy, and I wake up with my sleep practical low. So I think I must be being 8, but I also have pretty bad allergy, especially around this time of year.
I see. It sounds like you might be dealing with a case of conjunctivitis, which is often referred to as pink eye. But considering your history with allergies, it could be a combination of allergic conjunctivitis and possibly something else. Let me ask you a few questions to get a better understanding. How long have you been experiencing these symptoms?
It started about 3 days ago. At first, I thought it was just my allergy acting up, but then the eyes got really red and start producing this thick discharge. That's when I start to worry.
You mentioned that you have allergies. Have you been exposed to anything that typically triggers them, like pollen, pet dander, or dust?
Yes, actually, my allergies are mostly triggered by pollen. And with the chance in seasons, I think that's what set it off. But I've never had my eyes, yet his but before.
Allergic conjunctivitis can cause redness, itching, and tearing, which matches some of your symptoms. However, the thick discharge and the crusting you're experiencing are more typical of bacterial conjunctivitis. It's possible that you have a mixed case, both allergic conjunctivitis and a bacterial infection.
That makes sense. I've been rubbing my eyes a lot because they're so itchy, which probably didn't help.
Rubbing your eyes can indeed make things worse, especially if there's already an infection. The bacteria can easily spread and exacerbate the situation. Have you noticed if your vision has been affected at all?
It's a bit blurry, especially when I first wake up, but it clears up after I've been awake for a while.
Blurry vision in the morning could be due to the discharge building up overnight. It's common in bacterial conjunctivitis. It's good that your vision clears up later in the day, but you want to be careful because conjunctivitis can be highly contagious, especially if it's bacterial.
So, how do I treat this? Should I be using my allergy drops, or do I need something different?
Since you're dealing with both allergies and a possible bacterial infection, we'll need to address both. For the allergic conjunctivitis, you can continue using your allergy eye drops to manage the itching and irritation. However, to treat the bacterial conjunctivitis, I'll prescribe antibiotic eye drops.
How often should I use the antibiotic drops?
You'll need to use them about 3 to 4 times a day. When applying the drops, make sure you wash your hands thoroughly beforehand. Be very careful not to touch the tip of the bottle to your eye to avoid contaminating it.
Okay, I'll be careful. Is there anything else I should be doing?
Be, yes, avoid rubbing your eyes. It's tempting, but it can spread the infection and make the irritation worse.
What about my contact lenses? Should I stop wearing them?
Stop wearing your contact lenses until your eyes have fully healed. Wearing them could aggravate the infection or cause it to return.
I'll do that. And what about my makeup? I use eyeliner and mascara regularly.
It's best to avoid wearing any eye makeup until the infection clears up. In fact, it's a good idea to throw out any makeup you've used recently, as it could be contaminated and might cause a reinfection.
I didn't realize that I'll get rid of it. Is there anything else I need to prevent spreading this to others?
Yes, conjunctivitis is very contagious, so you need to be careful. Wash your hands frequently, especially after touching your eyes.
Got it. How long will it take for this to go away?
If it's bacterial conjunctivitis, you should start to see improvement within 2 to 3 days after starting the antibiotic drops. The allergic symptoms may take a bit longer to fully resolve, depending on your exposure to allergens. If you don't see any improvement in a few days, or if your symptoms get worse, you should come back in for a re-evaluation.
I'll keep an eye on it. No pun intended. Thank you, doctor. I followed this instruction carefully.
You're welcome. Take care of yourself, and I hope you feel better soon. Don't hesitate to reach out if you have any questions or concerns.
I will. Thanks again.